What is a thoracoscopy biopsy for lung cancer? Imagine being able to look inside the chest without major surgery. That's what a thoracoscopy biopsy allows doctors to do. It is a minimally invasive procedure used to diagnose and stage lung cancer. The goal is to get a clear look inside the chest cavity and collect tissue samples from the lungs or the lining around the lungs, called the pleura. These samples help determine if cancer is present, what type it is, and how advanced it might be. During the procedure, a doctor makes small incisions between the ribs, usually near the shoulder blade or under the arm. Through these tiny cuts, a thin tube called a thoracoscope is inserted. This instrument has a camera and a light attached, which lets the doctor see inside the chest on a monitor. The doctor can then carefully examine the area and identify any suspicious nodules or abnormal tissue. If needed, additional small surgical tools are inserted through the same or additional incisions to take tissue samples or remove small lumps. Most thoracoscopy biopsies are performed under general anesthesia, meaning the patient is asleep and comfortable throughout the procedure. The entire process usually takes between 30 and 90 minutes. After the tissue is collected, a small tube called a chest tube is often placed. This tube helps drain air, blood, or fluid from around the lung, allowing it to re-expand properly and reducing the risk of complications like lung collapse. The chest tube usually stays in place for 1 to a few days, depending on how much drainage occurs. This method is especially useful when less invasive techniques, such as needle biopsies, are not enough to get a good tissue sample or when doctors need a direct view of the chest cavity. It provides more accurate samples for diagnosing lung cancer and helps determine how far the cancer has spread. This information is essential for planning the best treatment options. While thoracoscopy biopsy is generally safe and less invasive than open surgery, it does carry some risks. These include bleeding, infection, or pneumothorax, which is a collapsed lung caused by air leaking into the chest cavity. Patients might experience soreness or numbness around the incision sites for a few days after the procedure. Most patients need to stay in the hospital for monitoring and recovery, especially if general anesthesia was used. In summary, a thoracoscopy biopsy is a valuable tool in lung cancer diagnosis. It allows doctors to see inside the chest with minimal invasion and obtain precise tissue samples. This helps ensure accurate diagnosis and staging, which are crucial for choosing the most effective treatment. If you or someone you know is considering this procedure, it's important to discuss all the benefits, risks, and recovery details with a healthcare professional to ensure personalized and safe care.